Well, it is right at noon, so I think we'll go ahead and get started. And we want to welcome everybody to our Dairy Goat webinar series with Iowa State University Extension and Outreach. My name is Jennifer Bentley, and I'm a dairy field specialist housed in Northeast Iowa. And we've been doing this Dairy Goat webinar series throughout the year here, and we took the summer off. And so we're back here in the fall, going to wrap up our 2024 series today through November. And so today we're going to be talking about respiratory disease in dairy goats with Dr. Rachel Friedrich and Dr. Amanda Kreuder, both with the Iowa State University College of Veterinary Medicine. And as a reminder, as people are logging in here, I do have the two upcoming webinars that we do have scheduled. October 23rd, we're going to have Aloyna Michael from the ISU Vet College talking about small ruminant abortion diagnostics. And then we will have a date determined in mid-October for the November webinar where we're talking about common diseases in small ruminants. So as we begin here, I just want to remind everybody this is being recorded, and we do have a dairy goat YouTube channel on our ISU Dairy Team page. So if you want to go back and review it, you can go on our YouTube channel. I'll also do a follow-up email to the group, and you'll get that link as well. If you have questions throughout the presentation, feel free to put those in the chat box. We'll have some time at the end to address those questions as we go along here. So with that, I know Dr. Kreuder and Dr. Friedrich both have some intros on their slides here, so I'm going to let them introduce themselves. So thanks for joining us.
All right, thanks, Jen. So we'll go ahead and get started. This is the title of our talk. So goats and pneumonia, the tools we have and those we'd like to have for prevention and treatment. And we'll give you a little intro about ourselves.
Hi, I'm Dr. Friedrich. If you joined in May to listen about biosecurity, you got to meet me back then. So not much has changed in the last couple months. Still from a family farm, a diversified ag background in Northeast Nebraska. That led me to an animal science degree at University of Nebraska-Lincoln. And then I came out to Ames for vet school and really pretty much never left at that point. I got my DVM here in 2009, and then I went out to West Central Iowa and practiced mixed animal practice for several years, followed by a short stint in industry developing vaccines for swine and cattle primarily. And now I've been back at Iowa State about 6 years, have taken on primarily teaching and professional practice roles, which means I provide vet services to university farms and private clients in the Ames vicinity. I also consider myself to be an accidental goat vet. I grew up with cattle and hogs, did not have much for the small ruminant background. But when I went into practice, I happened to be the one with the smallest hands. So all of you know what I mean when I say that. I got to do most of the OB work for the small ruminants, and that's how I segued into this industry and have really enjoyed working with the clients. Outside of vet med is the people in this picture here. I have twins that are 11 and active in lots of different school and extracurricular activities, and my husband who designs houses for a living. So we keep things varied in our place.
Working. All right, there we go. Hi, I'm Dr. Amanda Kreuder, and so I have a lot of similarities to Dr. Friedrich. I grew up on a family farm in Northwest Illinois, crops, swine, cattle, not small ruminants. I did my dairy science degree here at Iowa State and then completed my DVM in 2008. So Dr. Friedrich and I were very close to each other in graduating here. After I graduated, I went out into private practice in Northeast Wisconsin, dairy practice almost exclusively, but then came back here to Iowa State and did my residency in large animal internal medicine and completed a PhD. And so I've been here at Iowa State ever since. I would also consider myself an accidental goat vet. Certainly when I was in private practice, there was not many people who wanted to do much work with the goats, and I was happy to see them. So I got my start there. And then when I've been here at Iowa State, I was fortunate enough to do my residency and PhD under Dr. Paul Plummer, and many of you probably know him and know the impact he has made in the dairy goat world. And so I have a lot of good training from him in this area. And so after I completed my residency and PhD, I was a clinician down in our food animal teaching hospital at Iowa State here until 2019, where I moved into more of a research and teaching role in the veterinary microbiology department. So you can see a few pictures here from my life outside of vet med. My husband and I run a small Angus seed stock operation. I have boar goats, so not dairy goats, but boar goats at least. And then we have 2 girls that keep us very, very busy as well. So that gives you kind of a little bit of a background on us. And so now let's dig into kind of the goals for today and some of what we want you to take away. And so we're going to start with talking about data and why it's important, case definitions, and protocols for treatments. We're also going to talk about the pathogens that cause respiratory disease in goats, as well as how we diagnose and treat those this condition. And then finally, we'll talk about risk factors and mitigation and some prevention strategies. So before we get to talking about the bugs and drugs, which if there are any veterinarians on the call, that's kind of what we are taught in vet school, is what bugs are causing the disease and then what drugs are we going to use to treat it. There's a lot of important questions we need to ask before we even get to that point. How do we know we have a problem? And so that goes back to the producer recognizing that there's something going on at their facility and having concerns about that. But that might be an anecdotal concern. And so if we can collect data related to that, that can be a very big help for the veterinarian in trying to help determine what is going on, how can we prevent it, and how can we best treat it. That also plays into determining the risk factors. If we don't have data to know when we are seeing respiratory disease, it's very hard for us to predict what is causing that disease and then mitigate it. And then also, if we don't collect data, how do we know if our treatments are working? So that's a really critical component that often gets forgotten, is that follow-up after we have treated animals for a disease, going back and asking the question, did we appropriately diagnose them? Did we appropriately treat them? And did we have success? So data is critically important. And because it's so important, we're going to talk about it here a little bit and how it can work for you and your farm. So written records are critical for a number of reasons. And in particular, you'll see at the very bottom, I have withdrawal time documentation. So when we're talking about respiratory disease, we're often going to want to treat those animals with a medication, an antibiotic. And it is very important that we keep written records to know when those animals were treated, so we can know when their withdrawal time is completed and when they might be able to be marketed either for meat or when their milk might be able to go back in the tank. To be able to adequately collect records, we have to have individual animal identification. So this might be registration tattoos, this might be collars or ear tags. It needs to be permanent and legible. So that way, anybody that comes onto your farm can identify that animal and know that these records go with that specific animal. Unfortunately, if you're a small producer and all the animals have barn names and just saying Chloe, the goat that looks like this, that works for one person, but it doesn't really meet the criteria that we need when it comes to written records and treatments. The other important thing that collecting data requires is having a good organizational system. And this can vary depending on your farm. For smaller operations, a pen and paper can still work as long as we are recording things along the way. For larger operations, things like Google Documents, Excel files, or even commercial software, as you get into larger and larger operations, become more cost effective. So depending on what works for your farm, adapting to your herd size and how much money you have available to put into the organization system is important. So once we have those 2 key things, the individual identification and an organizational system, then we can start collecting all kinds of data. So this might include birth dates, breeding dates, treatment records, DHI records, milk production, somatic cell count, all of those things can feed into the system and help you and your veterinarian make health decisions. Now, those health decisions and health events are what tend to be the hardest to record. So that is something that, again, you'll have to work with your veterinarians to develop a system that works for you. But as I mentioned at the beginning of this slide, it's really critical for withdrawal time documentation that we are doing those recordings and know when the appropriate withdrawal time has expired for these animals. So how can we use this data when we're talking about identifying and treating respiratory disease? So from an individual animal level, if we have, for example, milk records, it can help us identify animals that are off before they become really sick. So if we can identify an animal that has dropped in milk before they become depressed, before they aren't eating, and before they have progressed further down the disease, that can help us get that animal back into production sooner. So the more data that we have at the individual animal level to track when they become sick, the better off we are. On a herd level, this is probably even more important because it can allow us to identify trends that can then allow us to target prevention strategies. So if a producer calls and says, I'm having issues with respiratory disease in my kids, there's a lot of different stages and risk factors depending on what age those kids are when they're breaking with respiratory disease. And so knowing and recording exactly what age the kids are when they're treated can help us narrow in on what the causative factors are and then make a difference, hopefully, in the long run on preventing and not having to treat as many animals. This is also really important at the herd level for assessing for consistent treatment application. So are we using a good case definition and treating animals appropriately? Or are we over or under treating animals for respiratory disease? And then finally, this allows us to evaluate our treatment success or failure rates. And we can look back and say we treated X number of animals and this many were, stayed in the herd, didn't require retreatment. This many required retreatment or ended up being culls because they never resolved. So those are really critical things at a herd level to be able to identify. So now that we've talked about how important data is, let's talk about defining respiratory disease. And so all of you, when I say a goat with pneumonia, probably have an animal and some clinical signs that you picture. But more specifically, when we're talking about treatments and treatments that can be effective, we really want to focus in on what a goat with acute bacterial pneumonia looks like, because those are the animals that are going to actually respond to treatment with antibiotics. And it actually is a lot harder than you think to identify those animals with acute bacterial pneumonia. In an ideal world, to be able to identify an animal with pneumonia, we would have an accurate case definition. And so a case definition is the characteristics of that disease. So for example, a goat with pneumonia might be off feed, have a fever of over 104 degrees Fahrenheit, have a snotty nose, breathing fast or hard, a cough, milk drop, or any combination of those clinical signs. So that might be a case definition for pneumonia. So when we start thinking about these case definitions and clinical signs, there's actually a long list of clinical signs that can be attributed to pneumonia in goats. And it's important to keep in mind that while a few of these are specific to respiratory disease, a lot of them are very non-specific. And so there's been a lot of work done on the cattle side that we really aren't very good at identifying pneumonia and respiratory disease, at least acutely, and treating those animals when they can best respond to it. And I would say that on the goat side, we're probably in the same boat, that this is a hard disease to really pin down accurately. So common clinical signs, we might see discharge, either nasal or ocular, and I'll show you some images of that here in a little bit. We might see some changes in respiratory character. So we might have rapid shallow breathing. We might have open mouth breathing, which can progress to thumping, which are very obvious signs. and we might have a cough. Now, cough is one of those things that is one of the easiest to pick out, but it is also something that can show up in groups that don't necessarily have bacterial infections. Maybe they had a little bit of virus go through. It also is something that lingers for a long time after treatment. So we can't use cough in and of itself as a distinct indicator of active respiratory disease that needs to be treated. Behavior is really critically important to pay attention to. And so the animal's attitude is going to change as they progress through the different stages of pneumonia. So in goats, head down, in particular, tail down in goats is something kind of an arched back and tail down. I'll show you some pictures of that, is a really important indicator of when these animals are not feeling well. Other behavioral indicators, they're going to have reduced feed intake, milk production, or activity level. And as this disease progresses, they may be reluctant or unwilling to rise. And finally, body temperature. So a presence of a fever. So in goats, 103.5 is normal. We tend to maybe make our cutoff a little bit higher for really deciding if these animals need treatment. But animals that are really sick might have a low body temperature and be hypothermic instead. So that's also important to keep in mind. One caveat to these respiratory pathogens in goats in particular, unlike in cattle, we can see sudden death due to sepsis from Mannheimia hemolytica and Yersinia trihilosi. And so particularly in neonatal kids, the first signs that we've got issues might actually be sudden death. And even on necropsy, some of those lungs might look normal, but we still might have a problem with our respiratory pathogens. So that's something that's unique to goats that's worth keeping in mind on your operation. So that list, there was a lot of different things on that list that overlap with many other diseases. So we can't just use one criteria, like I mentioned, we can't just use cough to say that an animal has respiratory disease that requires treatment. Instead, we want to use multiple clinical signs and make our definition of pneumonia as objective as possible. So this is something that producers should work with their veterinarian and develop a scoring system to direct treatment protocols that work for your farm. And the advantage of doing that is if you call your veterinarian and say, hey, I got goats with pneumonia, or I've treated for respiratory disease, that doesn't mean as much as if you can call your veterinarian, point directly to the scoring system you've developed with them and say, hey, I have a group of goats where we've had fevers of over 104, we've had respiratory scoring signs of 2s or 3s, and that means a lot more to that veterinarian when you've worked with them to develop the scoring system to help understand what's going on your farm before they even get there. So things that we would consider in a scoring system to direct treatment protocols would include attitude, respiratory clinical signs, and rectal temperature. So here is an example of some of the different attitude scores that you might see in goats. So the 0 on the left is actually our normal goats. They're going to be head up, they're going to be paying attention to you, they're going to be tail up, and very responsive to everything that's going on in the environment. So that is our normal. Everything else on this slide, 1 through 4, would be an abnormal attitude score. So that goat that's labeled number 1, that's a goat with a tail down, hunched back, hiding in the corner. Those animals sometimes, because they're prey animals, they might only show you this for a very short amount of time. And then as soon as you walk closer to them, they're going to put their head up, they're going to bring their tail up, they're going to move away from you. But they're telling you that there's something going on. And we actually want to catch animals in this early stage with mild depression because that's when we're going to have our most effective treatment for respiratory disease. As we move to number 2, that's an animal that's, again, got its head down, it's got its tail down, its back is hunched, it's kind of ganted up. But these animals aren't going to pay as much attention to you when you walked up to them. So that animal might be reluctant to move away from you. And this is a moderately depressed animal, again, progressing further down the disease progression and maybe getting less likely to respond as favorably to antibiotics. Our 3s and 4s are most seriously affected. And so 3s would be animals that are laying down. They're still external, and their head is at least up, but these might not want to rise when you approach them. And these are very sick animals. Number 4 is our moribund animals. So these are animals that are laying flat out. They're not external anymore. They're not responsive. They may be approaching comatose. And these animals are often the ones that will not respond to therapy. And actually, if we catch them at that stage, humane euthanasia may be the best approach for those. So we really want to be finding animals that are in that 1s and 2 stage, especially 1 stage, as quickly as possible to identify them for treatment. So that attitude system, that they could look like that and be depressed because they have respiratory disease, or they could have a FMANCHA score that requires treatment. They could have diarrhea. So very nonspecific. These are our respiratory signs that are more specific. And so looking at nasal discharge or ocular discharge, goats can normally have a little bit of serous discharge, maybe a little bit of crusty or tiny bit of cloudy discharge. So that's our score 0s and 1s. However, when we get to the point on the right-hand side where there's scores 2s and 3s, where we've got bilateral, really cloudy or excessive mucus discharge, which is what's pictured in 2. You can see that kind of draining down its nose. And mucopurulent discharge, so that's the white cloudy discharge on the scale here, a 3. Those are the ones that are very obvious that we've got something going on in the respiratory tract. Down at the bottom, we've got respiratory character scoring. And so we can score that based on how fast they're breathing, so respiratory rate. So that's on the left-hand side. Normally goats are going to be 10 to 30 breaths per minute. That we can have that slightly increased. That could be because of weather conditions as well. But when we get to the market increase of over 60, then we know that we've got a significant issue. Over on the right-hand side, as far as respiratory effort, if you've ever paid attention to how goats normally breathe, we should have a nice, expansion of the chest without a lot of extra effort. But if we start using abdominal muscles, they have open mouth breathing or extended head and neck, that's when we know we've got some significant issues. So here is an example of a goat that's got some abdominal breathing along with increased thoracic effort. So you can see it's a ganted up goat, tails down, and it's really using those abdominal muscles as it's trying to take in breaths there. And that's a sign that we've got really significant respiratory disease going on. So an example of a case definition for treatment decisions that you might work with your veterinarian would be, you're going to identify animals that have a rectal temperature that's above 104. Again, that's a little bit higher than our upper level of normal, 103.5. But those are the ones that we're most certain have active disease. An attitude score of, depending on your herd, 1 or 2. Again, the more we're catching in that 1 stage on most farms, probably the better. And then some sort of respiratory sign that goes along with it. So either a nasal or ocular discharge score or a respiratory score of greater than or equal to 2. Working with your veterinarian, you can also adjust these categories based on your herd or when we have herd outbreaks. So if you have already identified that you've got a significant issue on your farm, we might adjust these criteria lower to be able to catch animals earlier in their disease process. And then once we actually have this case definition and we can go out and find those animals, then working with your veterinarian to define the treatment protocol for animals, both individually or when we've reached a point where we might need to look at treating a group of animals because we've got significant enough respiratory disease in that group. So next, we're going to talk about finding a cause for the respiratory disease, and something that's really important to keep in mind, and I've mentioned this a couple times along the way, that when we're trying to treat respiratory disease in goats, we want to treat those that have acute bacterial bronchopneumonia, because that is what our antibiotics are actually going to be effective against. So this is a differential diagnosis list of all of the different things that can cause a goat to appear to have respiratory disease. And so you can see we've got infectious causes. I've got in red those bacterial bronchopneumonia agents, Mannheimia hemolytica, Pasteurella multacida, Fibrostenia trihilosi, as well as Mycoplasma mycoides. So these are the ones that if we catch them early are going to respond well to antimicrobial therapy. Viral agents, you can see down on the left-hand side, that's what predisposes them to disease with the bacterial bronchopneumonia. So parainfluenza virus, respiratory syncytial virus, adenoviruses, herpes viruses. We're also finding some newer viruses that might be predisposing to disease. So those are our infectious diseases. But we also have acute non-infectious diseases. And so if we're talking about neonates, if they're born too early, they will appear to have respiratory disease. Aspiration pneumonia, also problematic for neonates. We can have toxins that can cause respiratory disease, as well as trauma, diaphragmatic hernias, and pneumothorax. So having these case definitions to really point us towards treating only those animals that are most likely to have bacterial bronchopneumonia and respond to treatment is important. So that's on the acute side. And then if we start thinking about animals that have had respiratory disease for a longer period of time, our bacterial pathogens that we start to see in these chronic cases, such as Trichinella pyogenes and Corynebacterium tuberculosis, cause of CL or caseous lymphadenitis, these are not going to respond as well to antimicrobial therapy. So that's why it's really critical that when we have the acute bronchopneumonia, we try and catch those with our case definition and treat them early before it becomes these chronic cases that don't respond as well to antimicrobial therapy. Somewhat unique to small ruminants, you'll see the small ruminant lentiviruses. Most of you are probably aware of CAE or caprine arthritis and encephalitis virus. That can cause some respiratory signs. And so animals that are slowly progressive in developing respiratory signs, not running a fever, those are not going to respond very well to antimicrobial therapy and instead may need to be culled. We can also see parasitic respiratory disease due to lungworms. We can see nasal bots that can cause nasal discharge. Enzootic nasal tumor virus can also cause masses in the nasal passages and cause nasal discharge. So all of these are other causes of respiratory disease, but aren't going to respond to antimicrobial therapy. So how can we diagnose what is going on with these animals? And so some of the easy approaches that can be done in live animals are things such as nasal swabs or deep nasopharyngeal swabs. And as I'm talking, I'm going to play this video here of us taking a deep nasopharyngeal swab from a goat, so it can be done fairly quickly. Transtracheal wash samples, which is what's pictured in the lower right-hand corner, is actually a better sample than the nasal swabs because it gets a sample from down into the lungs. But it just takes a little bit longer. And so maybe a little bit more challenging to do. So your veterinarian may choose one or the other of these things. On a dairy operation, we can look at bulk take cultures, particularly for Mycoplasma species, potentially also for Mannheimia. And then lung ultrasound. That's something if you call your veterinarian out for an individual animal or groups of animals where you think you've had respiratory disease go through, lung ultrasound gives us a picture of what's going on inside those lungs and may be helpful to diagnose either chronic or acute pneumonia. It's also critically important that we perform necropsies on animals that die that we suspect are due to respiratory disease, or really if we are having any sort of disease outbreak on a farm, so we can confirm the clinical diagnosis, because it is often very common that we think something caused the disease and that's why the animal passed away, and then we open them up on necropsy and find it was something completely different. So this is really, really important to work with your veterinarian and on a regular basis have them come out and look at animals that died or that need to be euthanized. And so then from these animals, we can submit tissues or lung swabs that can then be sent off to the diagnostic lab and help us get accurate answers. In an ideal world, we may actually sacrifice, if we're having an acute outbreak, 1 or 2 animals that are acutely affected that haven't been treated, so we can really get to the cause of what's going on and make appropriate treatment decisions. But you can see on this image here from necropsy, on the right-hand side of the chest is the abnormal lung with a lot of fibrin down here in the lower part of the chest. And then in the middle of the chest is what normal lung looks like. So very quickly, a veterinarian could open this animal up, very quickly decide, yes, this animal died because of respiratory disease, and have a confirmed diagnosis. So a few more comments on diagnostic testing. So which test is selected depends on the goals that you and your veterinarian talk about. Both all the lung tissue swabs, nasal swabs, transtracheal washes, we can use to identify what pathogens are present. PCR looks for the DNA of the or RNA if it's a virus of the pathogen. There've been a lot of these panels that were developed for cattle. So just a caution, those viruses, the same types of viruses exist in cattle and in goats, but they may not cross over very well on these diagnostic tests. They might be just different enough that you could have a respiratory syncytial virus there that's a goat-specific virus that doesn't show up with our bovine test. But the PCR for our bacterial pathogens is pretty consistent. We can also look for our bacterial pathogens through culture. So that's the most common way we're going to look for Mannheimia hemolytica and Pasteurella multocida. And then if your veterinarian can send in tissues of the lungs, that allows the pathologist to look at it under a microscope and actually correlate, yep, the pathogen was there and we see it at the site of the lesion and we know that was what was causing the disease. So those can all be very valuable diagnostic tests. So we can answer that question of what pathogens were there. And then we can also try and answer the question of what treatments are going to be most effective and what prevention decisions should we make based on this. And so one thing we can do with a cultured bacterial isolate is antibiotic susceptibility testing. And then when we talk about prevention decisions, typically we talk about vaccinations, although Dr. Friedrich is going to talk a little bit more about the challenges we have with that in goat medicine. So just a final note from me here on the diagnostic testing. I mentioned antibiotic susceptibility testing. So that's where we're testing the bacteria across a bunch of different antibiotics to see which ones might be most successful at treating the disease. The downside is that there are no approved clinical breakpoints in goats. So we don't have enough data to truly answer the question, is this antibiotic going to be successful at resolving the infection in the goat species, unfortunately. So when your veterinarian gets data back from the diagnostic lab on antibiotic susceptibility testing, they're going to be using interpretations extrapolated from bovine or human breakpoints. And so we might not always be able to take those at face value. And there are some antibiotics that these extrapolations are not acceptable for. And so that is a challenge that we have in goat medicine, in that we don't always have all of the data that we need to make appropriate decisions. However, I would still recommend if you are dealing with respiratory disease outbreaks that we perform antibiotic susceptibility testing. We have recently identified particularly Mannheimia hemolytica that is resistant to several of the antibiotics that we routinely use in goat medicine, either on label or extra label. And so I think it is valuable. It can answer that question, do we have a resistant pathogen there? And should we avoid treatment with certain antibiotics because of it? All right, at this point, I'm going to pass this off to Dr. Friedrich and let her take you the rest of the way.
All right, guys, just gonna let you catch your breath for a second while we do a little switcheroo. So we have talked an awful lot about diagnosis up to this point. Now we're going to get into treatment and prevention. So first off, like kind of how we already discussed, ideally our treatments would be based on our clinical presentation. That's the signs of the animal that is presenting to us that fit into that case definition of respiratory disease. the history for that particular animal and the entire herd as a whole, as in what has worked on your farm, or what has appeared to work on your farm in terms of antibiotics before. And then finally, in an ideal world, we would have diagnostics. So we'd have already been able to identify that it was a bacterial pathogen and that we knew what it was susceptible to. But we all know that we don't live in a perfect world. And so we do come down to considerations on the individual animal versus a herd level. It's pretty easy if you have 500 goats and you've had 10% of them develop respiratory disease in the last 3 days to say, okay, we need some diagnostics. We need to know what's going on here because we have a pretty big risk of spreading it to the rest of the herd. Versus I have one individual animal out of that 500 over the last 2 months. And so some of those considerations pull us out of that ideal world and into more of what's practical at that point. As we previously mentioned, of course, anytime we're doing a treatment here, these are classified as food animals in the eyes of the USDA and the FDA. That does not mean that all of the animals that we work with are destined for that. But in legal terms, we do have to consider them food animals or food producing animals. So we have those withdrawal considerations. And because there's goats and there's very little on label, the next thing that we consider in our treatments is, can we use extra label drug use rules to allow us to incorporate treatments that are not labeled for goats currently? So what is ELDU, or extra label drug use? Because we have very few things that actually have a pharmaceutical described label for use in that intended species, which is goats for us, we use a lot of things off-label. Off-label basically means any way that is not currently listed on the language. So if the label says it's for cattle and treatment of respiratory disease, but we're using it in a goat, that's an extra label manner. If we have a different duration of use or dose or anything like that, that's an extra label manner. So in order for us to do that, we have to have a valid VCPR with you as a producer in order to be able to prescribe off-label. A VCPR is a vet client patient relationship, and it's defined differently from state to state. But in general, it means that the veterinarian has sufficient knowledge of the production system to be able to prescribe the use of that pharmaceutical on that site. Extra label drug use also requires that we either have no approved drug for that intended use. This is a lot of the time what happens with small ruminants because so few things are labeled, or that we have approved drugs, but they don't contain the active ingredient that we need. So this is that example where an antibiotic may not be effective simply because of the nature of the pathogen that we're trying to target. So if we're targeting mycoplasma disease and we're trying to use a labeled antibiotic that attacks a cell wall, it's not going to work because the mycoplasma doesn't have the cell wall to begin with. So inherently, that antibiotic doesn't work for us. The last one that's most commonly used in terms of small ruminants is that the approved drug is not clinically effective when used as labeled. So what we're saying here is that we use it on label, we used it exactly how we were supposed to, and yet we still had animals that were sick at the end. They didn't respond to that treatment. And so in that case, we're switching classes to something else. The two in the middle that I didn't go over, that were skipped because they typically involve compounding, which is another no-no for food animal species. So we're usually using those three that have the stars next to them. Anytime extra label drug use comes into play, our withdrawal time has to take that animal to 0 concentration. So that means that there is no active or metabolite of that drug left within the milk or within the meat, which basically means we're extending those withdrawal times. Some of them can get pretty long. And again, records. If you can't individually identify an animal that's been treated, then the entire group gets held until the longest possible withdrawal time. Since we really don't want to do that, using the use of permanent individual identification is vital for this. Our classes of antimicrobials that are used to treat respiratory disease in goats are listed here on the screen. Classically, we had our beta-lactams, that's our penicillins, or our ceftiofurs like Maxell. Unfortunately, they're inherently not effective against some of our bacterial species that cause pneumonia, and they can have a pretty frequent administration requirement in order to keep that drug level where we need it to be. Things like fluorphenicol, as in Nuflor, or the macrolides such as Draxxin, have gained popularity because of that. If you're a milk goat producer, though, those have a different caveat to you, that they have extremely long milk withdrawal times. So for commercial production or production of any food product from those milk goats, we just really don't touch these on most farms, simply because we could be talking 45 to 90 days of milk withdrawal time. It's a long time to dump milk. The macrolides do have an advantage for us when it comes to our younger kids, though, because they do reach really high levels in lung tissue, and they stay there for a really long time, which is where the bugs are. So that's where we're trying to make them most effective. One caution to that, there's a product you might be familiar with cattle called Micotil or telmicin, which reaches high lung levels too, but is dangerous for humans. It's also dangerous for goats. So don't use Micotil in your goats. It can actually cause death in goats when it's used. One last caution to this, I see this from time to time where people are using Baytril to treat respiratory disease in their goats. Baytril is one of those rare instances for us where there is no legal off-label use in the United States. And since goats aren't listed as a species on the label, it's pretty clear that Baytril is illegal for use in goats in the United States. So please don't do that. Other therapies that can be added on to our antimicrobials in those acute bacterial pneumonia cases, NSAID therapies like meloxicam or flunixin can be used to just take down the fever, make them feel a little bit more comfortable, so they maybe want to come back up and eat a little bit better. When we look at the data on the cattle side, it doesn't show a benefit, but it also doesn't retract from the treatment either. So from a welfare standpoint, those NSAIDs can actually help us to make them just feel better and recover faster that way. Vitamin C has been studied extensively in terms of its antioxidant potential. In most blinded research studies, it hasn't shown a great benefit, but it is a therapy that is sometimes added on. Probably just generally good nursing care does as much for us in terms of supporting that animal while the antimicrobials have time to work. So making sure that they're getting nutritional support. If they're not eating, that we're getting them drenched, that we're getting them fed in some way, giving them fluids either orally or IV if they're not drinking very well, so they're staying hydrated. And then finally, one of our newer areas of focus for therapy is the use of immune modulators. So there are commercially available licensed for cattle products that are a fraction of a mycobacterium cell wall. And so how those work is when we inject it, it stimulates the immune response so that you get more white blood cell activity, especially in like lymphocytes. And its idea is to try to just kind of ramp up that immune system so that it attacks the pathogen itself. They haven't been widely adopted because cost can sometimes be prohibitive in some cases, but in young kids that are developing disease prior to when any kind of other therapy would have time to onset, this has been tried and anecdotally has shown some success. Treatment protocols should be developed with your veterinarian. So once you develop that case definition that tells you this is how we identify what a case of respiratory disease is, your vet can work with you to identify a treatment protocol. So once we've identified a case of pneumonia, we're going to treat with drugs A and B. We're going to wait an appropriate post-treatment interval. So each drug has a number of days after it's administered that you want to give it time to work before you give the next round. And that includes some time for just body healing too in there. So if we get through round one and we're still showing the same case definition, we move on to round two. So each one of those protocols is farm dependent, and it should be a joint effort between you and your vet to develop that treatment protocol. We often use those case definitions that helped us define the diseased animals to define whether or not it works. Like if they still meet the case definition at the end of their post-treatment interval, we're going to say it didn't work. And at that point, we call that a treatment failure. And then we move on to the next level. And we keep doing that. And we're keeping track of what works and what doesn't in our herd too. Overtreating can make a protocol look better versus undertreating makes it look worse. So if we're picking out animals that aren't actually sick and giving them an antibiotic, they're going to look like it worked, even though they would have been fine without it. Some things that are reasons for treatment failures. So there is no perfect treatment protocol in any scenario, whether we're talking about respiratory disease or anything else in animal husbandry. We're going to have some that are failures. Some are failures because their body just literally can't handle it anymore. There's been too much damage for any treatment to overcome. There's other times where we have treatment failures because we had a poor case definition. And what I mean by that is either we completely missed a diagnosis. It happens to absolutely everybody. We called something that was not pneumonia instead, and we lost the animal anyway. Or we were late. So instead of catching them in that stage 1 of depression, an early respiratory disease, we didn't find them until they tipped over into stage 2 or 3. And now we had a much higher hill to climb just to get over it in the first place. There's also times where the actual cause is something that is non-responsive to the current available treatments that we have. Our biggest guns right now are against bacterial pneumonia. So if we have something like CAE, which is progressive pneumonia that causes a lot of scar tissue coming into those lungs, we don't have a good treatment to stop that. All the antibiotics in the world aren't going to do anything against that virus, and it's just going to become a failure in the end. We use the wrong dose. I used to have a receptionist who would say that she could be 10 pounds off on a chicken. So, I mean, we are all eyeballing sometimes for weights. We could be wrong. We could be off by 20 pounds. So we're underdosing those animals, or we're not using it for long enough, or we're just accidentally picking the wrong antibiotic. All those are reasons why it can have an apparent drug failure. And then we might have a pathogen that's resistant to that antibiotic of choice, either inherently in the case of like the mycoplasma, or potentially with the antibiotic resistance, like with the Mannheimias that Dr. Kreuder mentioned earlier. So some prevention strategies as we're getting ready to wrap up here. Those of you that attended the biosecurity webinar back in May saw this little snapshot here as part of that presentation, where we talked about disease, the yellow star in our picture being a combination of interactions between the environment, the pathogen, and the host, and the risk factors that went into that development of disease. So preventing it involves managing those risk factors. I'm not going to dive much into biosecurity today because we already did that earlier this year, but having that biosecurity plan in place so that you're not buying in your own problems. Vaccines is a question, target mass medication, and test and eliminate are questions too that we're going to talk about a little bit more here coming up. So when we come to talk about prevention and managing risk factors, we're generally dividing those into animal-based risk factors and environment-based risk factors. Some of those animal factors can include everything from the age of the animals to their genetic potential, to their nutrition, whether or not they're having a concurrent disease like a heavy parasite load or subclinical ketosis or mastitis on top of it. But the biggest one that I'm kind of talking about today is stresses. So stresses is one of those things as a manager that we can make some adjustments to. What we really want to do is avoid stress stacking. So we're trying to make it so that our management does not put stressful things on top of each other. We're not weaning and moving across the state. We're not weaning and castrating at the same time, for example. We're not switching the diet right about the time that we're giving a vaccine that might make them feel kind of ick for a couple days, So if we can avoid stacking those stresses on top of each other, that overall limits the amount of stress hormones that are released and keeps them overall generally healthier. Okay. For environmental factors, those are usually things that we're thinking about in terms of like our buildings and our feeders and our designs that way. And we target in on ventilation and air turnover rates in a lot of those cases. And this also includes things like stocking density, the amount of feeder and water space, and how much nose-to-nose contact we have between animals. I'm going to focus in on ventilation here for just a second. This slide was actually adapted from a webinar on dairy goat housing, ventilation, and milking systems that was presented by Brian Doherty in March of 2022. Also available on YouTube for you to watch. And it talks about the air changes per hour, or the ACH, and the cubic feet per minute per head of airflow within the building. Noting that the warmer it gets, the more air changes per hour we need and the more airflow we need. And young animals are not the same as mature animals. We can't have a building that necessarily is designed exactly perfectly for both at the same time. I'm going to try to see this video play for you guys here. This is a ventilation assessment that was done on a calf barn, calf housing, so individual calf stalls. They're half curtain walls, and there's a tube ventilation down the center of it. What you're going to see is, as the time lapses, the students are walking through the building. They're using foggers to produce a mist fog throughout the entire building until it gets so thick that we can't see the back end of the building, and that's when we start our clock. And now we're just waiting to see how long it takes for that fog to completely clear to where we can see the backside of the building. Now, remember, this is during the winter time, so we were talking about 4 air changes per hour was our target. And we're going to see just exactly how long it takes to clear. Again, time lapse here. And so we're seeing we're past the 15-minute mark already. So that should have been our first air change at 15 minutes. We're still not there. We're going in on the 30-minute mark right now. We're still not there. There's some students and a graduate student going through taking some measurements while we do that. Finally, we're at almost 30 minutes. So we were only getting 2 air changes per hour through that tube ventilation. We weren't getting enough air turnover in that building to keep fresh air in there. If everything's going great, this isn't something that needs to be done as far as a diagnostic, but if you're having problems or you're putting up a new facility and you want to double check it, this is a good way to check your ventilation rates. Biosecurity plans, biggest question I have for everybody is, do you have one in place? If you don't, it's time to put one in place before we bring any new animals in. We definitely don't want to go out and buy our problems and give us more things to worry about. Typically, we're talking about complete separation of new animals, separate site if possible for a minimum of 30 days, no nose to nose or shared airspace if that's not possible for us. And then a question mark of testing prior to introduction. So why is that a test? For things like CAE virus that can cause progressive pneumonia, we've got a pretty decent blood test for that one. But if we're talking about those bacterial pathogens, they naturally live in the upper respiratory tract of those goats. So even though it's there, it does not mean that it's causing disease at that moment. And I kind of challenge anybody out there to find a goat that doesn't have some Mannheimia or some Pasteurella up in those nasal passages. So you're really not able to introduce completely negative animals. That's why our testing has a question mark with it. It depends on the pathogen. Vaccines, just like with all other things goat, there's lots of limitations on what's available. So there's no viral vaccines that are labeled for goats currently available. Instead, we have people that are using bovine intranasal viral vaccines off-label. Anecdotally, probably provides a little bit of interferon boost for those animals as a protection, but not a cross-protective antibody effective against the pathogens that the goats have. There's Mannheimia and Pasteurella vaccines that are labeled for goats. This uses the whole cell bacterin model. So what that means is we grow it, we kill it, and we inject it. So the efficacy there really depends on which adjuvant the company uses to produce that vaccine. Some of them are better than others. In general, Mannheimia vaccines are kind of wishy-washy, so even on the cattle side where we have a whole lot more available. On the goat side, tough. They can be a tough thing to work with. I'm sure there are several of you out there that will swear up and down that it has changed everything in your herd. It can be used as a tool, but I wouldn't rely on it for your entire protection. Also, has never been demonstrated efficacy cross protection between the cattle vaccines and the goats. And a lot of that comes back to which strain of Mannheimia actually causes disease in those two species. Additional prevention strategies. So again, familiar with cattle, you've probably heard about targeted mass medication or metaphylaxis. This is a common practice where we give high-risk cattle entering feedlots all an antibiotic on arrival to try to protect them against that disease that they're incubating. Protocols have gotten better as this has been used longer, but it does still have its issues. You know, we run the risk of overuse of antibiotics or inappropriate use. There are some groups that never would have gotten sick no matter what you did to them. There's others that would be the opposite. So if you are treating all those calves that would have sailed right through, or all those goats that would have sailed right through, you're exposing those bacteria in their nasal passages to an antibiotic and potentially causing resistance as a result. We have seen that cause resistant Mannheimia in cattle, with ongoing research is showing more evidence of that in goats as well. The effect on the microbiota, that basically means what does it do to the good bacteria that are in their gut that we want to work to digest all of that feed. Some antibiotics have more effect on the gut microbiota than others, and they can upset that and upset their digestion as well. And then, of course, going back to the withdrawal times and the residue potential as well. Test and cull. So we talk about elimination strategies a lot, and this seems like the perfect answer, right? Why don't we just test for it? We'll find the ones that are positive, we'll get rid of them, and the problem will be solved. Well, that seems like a really good idea, but there's a lot of caveats to that. Most of these pathogens we've talked about today are ubiquitous. They're everywhere in the world. And so finding an animal that is negative is almost impossible, right? They're normally part of the upper respiratory flora, like we've mentioned previously. So trying to eliminate it is only as good as can you find a negative animal in order to replace. That's a tough call in a lot of situations. There's also each diagnostic test that we use has a positive and negative predictive value. How good is that test at finding the true positives and the true negatives? Some tests are really good, some are not so much. So are we running the risk of calling out a really good animal that because of a false positive? Or what's the risk of accidentally missing a true positive instead? All of these factors play into our decision of whether we're going to try to test and eliminate. Another great conversation to have with your vet. So in summary, a couple short bullet points here. Collect that data, find a system that works for you, review your data regularly, identifying those trends that can help us target some of those prevention strategies and those therapies earlier in the course of disease so that we can hit it hard, hit it fast, and get on top of it better. There are diagnostic and treatment options available that can be tailored somewhat farm to farm, and what works on your neighbor's farm may not work on yours. So again, working with your vet there. And then probably from our standpoint and yours as a producer as well, is that if we can prevent it, that is worth way more to us than treating it in the long run. So identifying those risk factors on your farm that might be setting you up for some of these diseases to take hold, and finding a mitigation strategy, whether that's addressing your ventilation or your new animal intake protocols or your weaning nutrition or any of those kind of things can make it smoother for those animals so that they don't end up getting sick in the first place. Some resources, there's great extension websites, of course, plug for the ISU Dairy Goat extension page. Also Minnesota, Penn State, Langston University all have really good information in there too. Ration balancing software that Iowa State produces as in the goat brands. If you're not already listening, the Boz and Bleats podcast from AASRP is a good one for general information. And then I'm going to let Dr. Kreuder give a little plug for some upcoming research that she has that she would love to have you all participate in.
All right. So you will see that there's a QR code here. And for those of you that are producers or veterinarians that are listening to this, We recently received here at Iowa State a USDA Sustainable Agricultural Systems grant to look at dairy goat production. And this is a very large grant that focuses on a lot of different areas of dairy goat production. In particular, there is an emphasis on respiratory disease in dairy goats. There's also some work that's going to be done on mastitis. There is some workforce development. There is some sustainability. There is carbon life cycle. So there's a lot of different factors in this. And we are going to be reaching out for stakeholder input, as well as potentially looking for farms that might have respiratory disease outbreaks that they would like some sampling and diagnostics done. So if this sounds like something that you might want to have more information about in the future, this QR code will take you to just a quick survey where you can put in your name and your email address and just tell us, hey, these are the things I might be more interested in when the grant is looking for some stakeholder input that we could reach out to you. So would appreciate anybody that's interested to fill that out. I'll come back to this slide, but I think at this point we're ready to answer any questions that you've got. So I will leave it up there. And I think I saw something come up in the chat. If I can get the computer to decide to show me the chat.
Thanks, Dr. Kreuder and Dr. Friedrich, for your information here today. It's been really great information. And I did put in the chat the handout for today's presentation. So if you get a chance to download that, you can look at that. Otherwise, I'll include it in an attachment when I send the follow-up with the link. That should be ready to go within the next week for this archive of the webinar. I also did put in the chat box a link to our evaluation for today's program. Us in Extension, we like to know how our programs are doing and what information we can provide to those that are listening. So if you want to go ahead and click on that, that'll help us with future programming as well as your knowledge gain in today's program. So I'm not seeing any questions right at the moment, but if anybody wants to put any questions in there, go ahead. I do have a few that I was thinking about, and I think you kind of answered some of those along the way. So maybe not as maybe you don't have quite an answer because they were already answered in there, but I was thinking about lung ultrasounding and how it's used in the dairy cattle world. Do you think that'll get to the point of being used in the dairy goat world as well, where we're kind of more routinely using lung ultrasound?
Yeah, I can take that one. So I think that's a really good question. And so in the dairy cattle world, there are some who are doing routine screening of like post-weaning calves to look for evidence of chronic disease that was present from pre-weaning, and then making decisions on keeping them as replacements or treatment decisions based on that. We could do the exact same thing on the goat side. The anatomy is the same. Downside is it's a little bit harder to get our probes that we have in between the rib spaces of little goat kids compared to calves, but we can still see a snapshot of what's going on in the lungs. I think that's something that if your herd is having significant issues in animals pre-weaning, post-weaning, and you want to get a handle on is the disease present before they get to post-weaning, it's something that we could do. I think cost benefit is probably the biggest issue. You know, the value of an individual calf is a lot higher than an individual goat. And so you may end up, if the decision is made to do it, you may end up going and doing, you know, a certain number of goat kids and not doing the whole group.
Yeah,
for sure.
Yeah, the major limitation is we're usually talking young stock for this, right? We use it in like the CAE chronic progressive pneumonias to show us, okay, this is not going to get better, right? Like there's no point in continuing to treat this situation. We're into more of a humane euthanasia or a culling decision at this point, because there's just so much damage to the lung and it continues to progress. So on an individual animal basis, used it that way. I think Dr. Kreuder hit the nail on the head that we tend to use it on the dairy side for trigger points for mass treatment in calves or decisions on keeping or not keeping them. And because those little rib spaces are so much smaller and we're only seeing a small section versus our calves where we have more to look at, I think it's just harder to make those, to find those little tiny spaces in there where there's small amounts of disease than it is in the larger ruminant animals.
Great, thanks for answering that question. I do see a few other questions that came in now. So some additional tips for organic producers around managing respiratory?
Yeah, the prevention is the absolute key there, right? Because I mean, when we're talking about bacterial pneumonias in organic situations, or basically anything that we would normally treat with an antimicrobial for, that's out of the question unless that animal is coming out of the program, right? And so we are really putting all of our drive and our focus into investment in those prevention strategies. And it's probably not a popular opinion, but I don't think we can manage conventional and organic animals the same. And they have different things that they need that we can't keep considering the same thing. And one of those things is stocking density, unfortunately. Like when it comes to a risk factor for respiratory disease, the tighter we pack them in there, the more likely we are to spread pathogen nose to nose, the more stressed out they get, the dirtier the pens get faster. And so for a lot of programs to be successful without some of those other tools, it really manages those risk factors. And one of those things might be spreading them out into more land. The further we spread them out, the more less contact they have and less likely they are to be moving stuff from animal to animal. It's a good one. It's unfortunate. It's a harder scenario to be involved with for sure.
And it looks like there was a question on maybe if diarrhea is a clinical sign for early respiratory infections.
Yeah, so I mean that's a good question. So we actually have done some research. It's more feedlot goat, but dairy breed, meat breed over the last couple summers. I think anytime you stress goats, you have a chance of there being some diarrhea. Anytime that you have what's called endotoxin, which is kind of toxins that are on the surface of some of these gram-negative pathogens, you have a risk of there being some GI upset and some diarrhea that occurs. So yes, I will say in these groups of animals where we've stressed them, just like you would stress a calf coming to market and ship them from all over the country, we see a lot that came in with concurrent diarrhea and pneumonia. But I would not use that, just like we already talked about, as a reason to treat them with antibiotics. I would use that as a reason to flag that animal and say, hey, I need to look at it. I need to check a FAMACHA score. I need to take its temperature. Does it have other respiratory signs? And then use these a true case definition for deciding, okay, do I think it has pneumonia and needs treated with antibiotics, or does it have parasites and needs treated? You know, what might else be going on? But I think that's an excellent question.
Yeah, there's that's kind of where those diagnostics come into play too, because especially with neonatal kids, if you see them start scouring, they lose a lot of bicarbonate, they lose a lot of potassium and other electrolytes in that diarrhea, and that shifts their blood pH as a result. And so the body tries to compensate for that by increasing their respiratory rate to blow off more CO2 and balance out their blood pH. So there's a lot of times where we see what looks like pneumonia because we've got an animal that's breathing really rapidly like this, but doesn't have any other clinical signs of pneumonia. And if it dies and we do a necropsy, lungs are completely normal, but their intestine is not. And so that does show the value of the necropsy situation. And it can be hard to tell the difference between the two, especially in those tiny babies.
Yeah, excellent question.
Yeah, and there's another one that came in directly to me about aspiration pneumonia in kids, maybe just addressing that and questions around that.
Yeah, so I mean, I think that can be a significant issue, particularly on dairy operations where we're pulling them off the does, we're feeding them depending on, how good of a job we are of taking care of the nipples and things that could be a higher risk. Aspiration pneumonia can also, those kids that come out brown stained, they're covered in meconium, they can get aspiration pneumonia when they're in utero. I think it becomes really hard to know for sure that that's what we're dealing with, but those would be we would see it typically if it's coming from in utero in those kids a couple of days after birth. If it's coming from some issues with the feeding equipment, it could occur at any point in time. Bacteria are still going to be a problem and causing the disease, but it's going to not always be our common pathogens. I would say those do tend to can be difficult to treat because of that.
Yeah, they are difficult to treat because we get not only the bugs coming in, but we've also got that material itself blocking their lung tissue itself. So air just literally physically can't move back and forth. For me, this is one of those data collection and necropsy points because it looks very different on a necropsy than a typical bacteria alone infection. And so when we're seeing that, especially if you are raising or hand rearing a lot of kids, if you're tube feeding colostrum, especially, and you have employees on your farm and you're starting to see an uptick in the numbers of aspiration pneumonia you're seeing, you might be able to trace it back through your data to maybe we need to do some retraining on how to appropriately tube feed kids, or we need to look at our equipment at such and such stage because we're seeing them develop this terrible pneumonia we can't fight at 5 to 6 days old, or things like that. So that's the data component that comes in there, is trying to identify that cause as much as possible so it can help us target where we need to make the changes too. Things happen, but really that should not be a high percentage of the cases that you're having. If we're seeing a lot of it or what we're more than we're comfortable with, it's time to investigate further.
All right, as we wrap up here, it looks like we have 2 more comments or questions. You might have to help me with this word here, urolithiasis.
Urolithiasis.
Yeah. Thank you. Could be a differential diagnosis for any signology.
Yeah. So if we're talking about male goats in particular, like, dairy feedlot animals, that's always should be on our differential list for a sick male goat. So, yep, agree completely. And then it looks like there's at least 2 more questions that I'm seeing here about nutrition. And maybe I'll let you take that.
Yeah,
one.
and I don't know that we really have a ton of time to delve into that today because nutrition could be its entirely own webinar series when it comes to keeping just general nutrition recommendations to begin with. Generally, animals that are unwell are those animals that are not eating for us whatsoever. And this runs the gamut from using like an alfalfa meal product as an oral drench with the stomach tube, having your veterinarian help you with that, when you're getting started with that, to continue to provide something for those bugs in the stomach to work on. All the way up to very valuable animals. We do have the capability for animals now to hospitalize them and put them on total parenteral nutrition or TPN that goes IV to them instead. So a lot of that decision point is based off of the value of the animal, and that could be dollars, that could be emotional value, it could be anything, just the perceived value of the animal, and what's practically feasible. Ideally, hydration needs to be first for us. So we're going to focus on that first, because thankfully on those adults, we've got that room and vat that can kind of hold some for us for a day or so to begin with while we make them feel better. But it's a balance for sure between stressing an animal out to feed it versus letting it basically go into a starvation state that it can't come out of. So I wish I could provide more specific recommendations with this talk. We're just kind of out of the time for that. Maybe we'll consider that for another one down the road.
Yeah. Just one other thought related to that is paying attention to the competition situation. So if you've got sick animals in an overcrowded pen, those are not going to compete very well to get to grain or hay, depending on your feeding situation. So a simple approach might be, if it's not going to stress them too much, to provide them a separate location where they can easily access feeded water and not have to compete for it. might be a simple approach.
So especially in early stage disease. Yeah.
Yeah. And then I think the last question that was sent directly to me was about research related to antimicrobial use in respiratory pathogens in small ruminants, since we don't have those clinical breakpoints. Are we doing research? And I would say, yes, we're trying. So that is some research that we've done here at Iowa State. We're probably, still a couple of years down the road from even a small portion of that kind of making a difference. But there's a lot more research that needs to be done, and it unfortunately is expensive. And so I think it's going to be, unfortunately, a slow road to keep making progress there, but we're trying.
Well, it looks like we're right at 1:15 here. And again, I want to thank you both for the presentation here today. A lot of very valuable information to take back. And again, feel free to review it on our YouTube channel, as well as some of the other presentations. I know you both kind of mentioned some of the other webinars that we've had in the past that have really great information. And we look forward to continuing our webinar series as we move forward through the fall. And we hope to see you again on October 23rd. So thanks again and have a great day.